First of all, I would like to thank the organizers for this opportunity and, of course, the audience for coming to listen. I would like to present you the study about on-farm mortality and related risk factors in Estonian dairy cows. As we all know that on-farm mortality matters. Loss of production and costs for herd replacement are unwanted expenses to farmers in the event of unassisted death and euthanasia. On-farm mortality, including unassisted death and euthanasia, is also an indicator of animal health and welfare. This slide illustrates Estonian dairy cattle population participating in milk recording in 2017, which includes approximately 95% of Estonian dairy cattle. There were over 80,000 dairy cows owned by 549 farmers. The national average milk production per cow has increased each year and has been over 9,000 kilograms during the last few years. Estonia is in the second place in the EU in the level of milk yield per cow per year. 15% of our herds, of our dairy farms are small holdings, having 1 to 100 cows. The proportion of those herds is decreasing each year. Around 17% of the herds are medium-sized holdings, and 68% are large herds, in which the majority of Estonian dairy cattle is kept. Most of the large-size herds are modernized during the last 15 years. They are mainly open freestall barns with parallel or carousel milking parlors, or insulated barns with robot milking system. Commonly, these new farms use innovative technique and are very modern and use less manpower. The aim of this study was to identify animal and herd level risk factors for dairy cow mortality. Knowledge obtained from this study would help to improve dairy herd health by applying preventive measures, and it would help to raise new hypotheses, providing input for future studies. Due to the characteristics of Estonian dairy cattle population in terms of herd structure and herd size, this study could provide relevant information to other countries who are moving towards intensification and large production farms. The study period started from the beginning of 2013 and lasted to the end of 2015. The data for risk factor analysis was acquired from the Estonian Agricultural Registers and Information Board and Estonian Livestock Performance Recording System. Survival analysis applying Weibull regression models were used for risk factor modeling. There were over 86,000 primiparous cows from 409 herds and over 109,000 multiparous cows from 410 herds in the analysis. The observation period started from the day of calving and lasted until the next parturition. This slide describes the survival probability of primiparous and multiparous cows. Starting from the day of calving up to next parturition or up to 600 days post-calving. As can be seen from the graph, multiparous cows on the bottom line, they have significantly higher mortality risk than primiparous cows. Although the lines representing the survival probabilities are fairly parallel, a higher mortality rate in multiparous cows is a result of higher death probability in the early postpartum period, and that is very well seen here. That meaning that risk factors associated with calving and early postpartum period might be most important in explaining dairy cow mortality. Risk factor analysis for primiparous cows identified that calving-related risk factors such as assisted calving and stillbirth may lead to mortality of cows. They are known to increase the risk of several diseases during early lactation period. Older age at first calving was also a risk factor for mortality. Older heifers might be overconditioned, which is known to increase the risk of assisted calving. There were also differences in breeds, indicating that Estonian Holstein breed cows have higher mortality compared to Estonian red breed. It is known that Holstein breed cows have higher milk yield and a higher demand for better feeding and management conditions, and they are more susceptible to diseases. We also found that cows in larger herds had higher risk to die. As herd size itself includes many factors, it is necessary to study further which factors are behind the observed association. Farms that underwent decrease in herd size during a 3-year study period might have aimed to cease production and not invest in herd health, consequently being associated with higher mortality risk. Indicators representing poor herd level production and reproduction, such as low herd average number of lactations and greater average number of inseminations per conception, were associated with an increased mortality hazard. All these parameters reflect the overall performance. Risk factor analysis for multiparous cows identified that cows having assisted calving and also birth of twins, triplets, or stillbirth abortion had higher mortality risk. We also saw that cows with the presence of subclinical mastitis just before dry-off had higher mortality risk at next lactation. Cows that had longer previous calving interval might have suffered a disease at that lactation, transferring into the next lactation. Also, these cows might be overconditioned at the next parturition and more prone to assisted calving and disease occurrence. Similarly to previous research, older cows had higher mortality risk due to higher incidence of several diseases and higher cumulative exposure time to diseases. Also, Estonian Holstein breed cows acquired higher mortality risk. Similarly to primiparous cows, we found that multiparous cows from larger herds were at higher risk to die. Poorer herd level fertility parameters, which probably represent inferior management, were associated with higher mortality risk. Higher herd average milk fat protein ratio was a protective factor. We cannot provide any sound explanation for this association, therefore this should be studied further. We also analyzed the association between first post-calving test milking results and following mortality risk. Lower milk yield post-calving was associated with higher mortality risk, but it was not linear, referring that higher producing cows might be in threat of metabolic diseases. Higher milk fat protein ratio indicating presence of ketosis, as well as higher somatic cell count being an indicator of mastitis, were associated with higher mortality risk. Mortality risk was lower in cows milked in automatic milking system compared to twice-a-day milking. This refers that individual supplementation of concentrates based on the cow's milk yield and stage of lactation, as well as more frequent milking, might be beneficial to cow's health. Also, robot milking system registers online cow level data, which could be used to discover sick cows faster. In conclusion, we found that risk factors for on-farm mortality are mainly related to calving and health status during early postpartum period. Based on these results, it is important to ensure easy calving, good health of cows at dry-off, and during early lactation. And of course, farms with better management have lower cow mortality. In future studies, it is necessary to find out which herd management factors directly influence cow mortality in order to provide more clear recommendations. If you wish to obtain more information about this study, please refer to our recently published paper. Thank you for listening.